What to expect after a total knee replacement. So this is a pretty big surgery. I consider it a controlled trauma because there is a lot of trauma, but it is controlled. And what's surprising and amazing nowadays is that they can get you up and walking day of surgery, which is pretty incredible when you think about the amount of work that goes into these knees. And so you are still probably a little bit on pain medication, but it's still incredible that you're able to do that weight bearing. In regards to therapy, your first day is usually within 3 days of your discharge. And when you come to physical therapy, what we do at Beyond is we just do a good examination to make sure everything's going good, not just with the knee itself, but the systems. So one things we look for early on are something's called a DVT, a deep vein thrombosis. That's a blood clot. And we want to keep our eyes on that. And typically what happens when you have a blood clot is you have increased calf pain, more than expected from the soreness of the trauma. You might even notice some additional swelling of the knee and below the knee. And so, as therapists, we do an assessment to see if we need to send you back to get that checked out. The other thing we want to make sure that doesn't happen is an infection in the knee. And so, what we'll do is we'll look at the bandage of the knee day one. When you come in, we'll make sure there's no excess drainage. If there is, we'll take it off. We'll look at it. We look for any increase in warmth, any increase in swelling, and any increase in pain. But those things also come with a knee replacement. So the last thing we look for is actually a fever. So if you're experiencing a fever, that can also indicate an infection. And so if we do sense that, then we also communicate. We'll text or call the doctor and make sure they're in the loop about that so they can prescribe antibiotics or anything like that. But aside from those two things, we also want to examine your range of motion. You're going to experience a decrease in your knee bend, which is called flexion, and your knee extension, which is the straightening of the knee. And, a lot of focus as a patient really tends to be on how much can we bend it. But at the beginning, the extension is actually the more important motion, even though you're only lacking by about 10 to 15 degrees of it versus 100 degrees of knee bend, because it's really important to get your knee extension back for walking. So that's something we make sure we look at, we address in the first day of rehab. So we're usually going to have you doing something that helps you with getting the knee straight. So that can include a calf stretch, hamstring stretch. That can include a quadricep set, just to see how good your quad is actually firing. And then that way we can see how you're doing at that point in time and just kind of progress from there. You might be on a walker, but most people come in with a cane. But it does happen. People come with walker, and it's not a big deal. That's just where we start. All knee replacements are different. Even someone with two knee replacements one on one side and one on the other side might have a completely different experience with their rehab and how well they progress. So don't get caught up on what you're looking like early on. We expect some pain, swelling. As long as we're progressing in the right direction, that's what we're wanting to see. So whenever you come to Beyond, you can't expect to be, one-on-one with each physical therapist, and we're assessing your range of motion, make sure every visit you're coming in, you're headed in the right direction so you don't fall behind, or we can pick up on anything that might be going on just to make sure your outcomes are good. So if you have any other questions about that, just give us a call at Beyond in either Franklin or Spring Hill. Thanks. Have a good one.